Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Changing cholesterol levels may be linked to dementia risk study. Older adults whose cholesterol changes over time may be more likely to develop dementia than people whose cholesterol is stable, regardless of the actual cholesterol level, according to a study published in the online issue of Neurology. The study does not prove that changing cholesterol causes dementia, it only shows an association. The study involved 9,846 people with an average age of 74 who did not have dementia or other memory problems. Cholesterol levels were measured at the beginning of the study and at 3 following annual visits. Participants were followed for an average of 5.5 years after the third visit. They took tests of memory skills annually. The participants were divided into 4 equal groups based on the amount of change between their first and fourth cholesterol measurements. The difference between consecutive yearly measurements was 91 mg per deciliter on average in the group with the largest amount of change in total cholesterol and 22 mg per deciliter in the group with the smallest amount of change. Lancet study unveils association between childhood trauma and mental health problems among adolescents. A new study has revealed a strong connection between childhood trauma and the development of psychiatric disorders in adolescents living in low and middle income countries. Findings are published in the Lancet Global Health. The research findings are based on the 2004 Pelotas birth cohort Brazil, which has tracked more than 4,000 children born in Pelotas from birth to age 18. The study looked at how trauma exposure from childhood affects risk for mental health disorders during adolescence. The results show that by age 18, 81% of the adolescents had been exposed to some form of trauma such as witnessing a violent crime, abuse or neglect. The more different types of trauma experienced, the greater the chances of adolescents developing mental health problems, particularly anxiety, mood and conduct disorders. By the age of 18, 1/3 of all mental disorders were potentially explained by trauma exposure. Can Mediterranean diet enhance brain health? Closely following a Mediterranean diet was associated with having better brain health among Hispanic/Latino adults in a preliminary study to be presented at the American Stroke Association's International Stroke Conference 2025. Researchers noted that the positive impact of the Mediterranean diet on brain health is not entirely influenced by cardiovascular risk factors such as blood pressure, cholesterol levels and blood sugar, nor by behavioral risk factors such as smoking and physical activity, all known to affect brain health. Researchers tapped into multi-site population-based longitudinal study of Hispanic, Latino adults aged 18 to 74 years to explore how to preserve their brain integrity. Researchers used specialized imaging techniques to investigate the microscopic and the visible changes in the brain. Adherence to Mediterranean diet intake was measured at baseline and each participant received a score between 0 to 9 with higher scores indicating higher adherence. The average Mediterranean diet score was 5.01. Protective properties of amniotic fluid, study finds. A new study published in the journal Research and Practice in Thrombosis and Hematosis found that the addition of amniotic fluid to plasma, the liquid portion of blood, improves the blood's ability to thicken and clot, which is a critical and likely a protective function throughout pregnancy and during delivery for both the birthing parent and the baby. Researchers analyzed the properties of amniotic fluid obtained by amniocentesis, a prenatal test that involves sampling a small amount of amniotic fluid to examine the health of the pregnancy from both human and non-human primates at gestational age matched time points. The findings showed that amniotic fluid increases blood clotting through key fatty acids and proteins that change each trimester and help regulate coagulation. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.